So I think we've got a good amount of people. Maybe we'll get started. All right. Feel free to keep filling out the poll though as more people trickle in. So welcome everyone. We're so excited to have you join us for today's webinar on how August Schools makes managing student health easier, more organized, and a lot more efficient. So we wanted to use this session to show you all the features that our nurses love. So as part of my role, I'm the product marketing manager here at August Schools, and I get to do the case studies with our schools. So I get to hear the stories about how they started using August, what made them start looking for a new EHR, why they love it so much, and it's the best part of my job, hands down. I love hearing all the different ways that August makes it easier for nurses who, as you all know, already have so much on your plate, and who do one of the most important jobs in a school. So I'll share these case studies with you all at the end of the webinar in case you want to check them out. But hearing stuff like how Holly at How ISD, her previous EHR, didn't have very strong security features, and she was worried about losing her license. Or, hearing from people like Sarah from Lancaster City School District, who, when they had a state audit, the auditors said, in quotes, "I wish every school district had August Schools because the reports were so clean and customizable." So it's stuff like that that makes us just so proud to get to build a platform that's being used by school districts all over the country. And we're excited to show you some of those favorite features today. Leading today's session is Laura, our amazing resident nurse at August Schools. Before joining our team, Laura was a school nurse herself, so she really gets it. She understands how tough it is to try to finish charting while 10 students come in all at once. So she's going to walk you through the platform and show you how August Schools is designed to work the way school nurses do. So it's designed to save you time, reduce your paperwork, and make sure that every student gets the care they need. So with that, I'll hand it over to Laura.
Hey everybody, thank you so much for being with us today. I'm going to share my screen here and kind of walk through 4 different features of the platform today. I wish we could cover everything within the platform, but that would take a little bit longer than 45 minutes. So we're going to go over a few things. We're going to go over immunizations. And then we're also going to cover action plans, as well as a new feature of our product, which is called procedures, that helps with students who have maybe they have scheduled items that they need to come into your clinic for, whether that be maybe a diabetic with blood glucose monitoring, a student who's being tube fed or G-tube fed, or maybe an intermittent cath or something like that, that you have to document on these procedures the same as you document on medications, and how you can delegate that kind of task to other users within the platform. And then finally, we're going to wrap up with how to look at your clinic data and like what you've seen within a month, especially around this time of year with flu season. Knowing what's coming in and out of your clinic is really important for your school and maybe your district when looking at illness and all of those types of things. So those are going to be the items that we're going to cover today. If you have questions while we're going, you can use the chat feature, and Victoria's going to be monitoring that, and she can stop me if it's something important to go back over. We can do that. And then if we have time at the end, we'll do a little bit of Q&A. So I'm going to go ahead and share my screen here. Are we good? There we go.
Okay, perfect.
All right, so this is the home landing page of the August platform. This is what we call the board. It is specific to you and to your login. So you can see here, it tells me, good afternoon, Laura. So I know I'm the one that's logged in, and this is a board for me to see all of my charting, and anything that I need to do for the day will be here within my board. So you can see we have some upcoming med administrations. I also have upcoming scheduled items that we'll talk about with our procedures. And then here, this little time ticker here, if this was a normal clinic day, you would be able to see all of the students that you've already seen for the day. This was one of my favorite features of the platform because if it was a really busy day, it kind of felt validating to come here and see all of the students that I had seen for the day listed in a nice long list here and the timestamps of when I saw them. So from here, I'm going to go ahead and open a student card. We have what's called a global search up here at the top where you can open up your student card. And you can see as I begin typing, it's going to show me all of the students that it's a fuzzy search. So it's going to give me multiple student choices here to select from. It's also going to display not only the student's name, if we have pictures, it'll display that as well, but their date of birth, their grade level, and then we can also display student IDs as well, so that you could search by any of those. If you wanted to search by ID instead of name, you could do that as well, especially for those students who may have very similar names within your system. Lots of schools have students that have similar names or the same name. So when I come in here, I can go ahead and click my student, and that's going to pop up our student card. One of the main reasons our student card is a pop out and not its own screen is so that you can still maneuver behind. If you were maybe in medication administrations and a student comes in, you would still be able to open up that student card without having to navigate away from the page that maybe you were working on in the first place. So it's a nice little feature that enables you to continue working without having to deviate from wherever you were if you were in the middle of something. So on this student card, you're going to see a lot of information, and you can make the student card bigger to view more information at once. But you can see my student here has type 1 diabetes. A note was added to this condition that they must check the blood sugar at snack and lunch. So you can see little quick information here. You can see all their demographic information up here at the top. But then down here is where this is basically the student's chart. You see a lot more information down below. You can see home contact information, addresses, their medications that they have on file. So you can see my student has a Humalog and a Baskini. And then you can also see that they have many other tabs here within their student card. And we're going to go into a few of these here. But these all hold only this student's information. So I'm going to come on over because we're going to start with immunizations. So if I come into the immunizations tab here, I can see, first of all, the biggest thing that's kind of sticking out here in red is that my student is non-compliant. If I scroll down here, it's going to tell me why my student is non-compliant. So you can see this little red grayish line here means that my student is non-compliant. If I hover over this icon, it's going to tell me why. So the student is missing a dose of varicella, and then the Tdap is also missing a dose. The booster, they haven't had their additional booster, and it is required for the state that this staging environment is in. So if I come up to my documents page here, I can look to see on my immunization table if I have an immunization record that has that information in it. So I can kind of do a side-by-side here of my screens. So I'm going to move this over so that I still have my student card up, and I'm going to come back to my immunization table. Now I can see here in my immunization record that I have for this student that he did have a Tdap, it just hadn't been entered. And then for my chickenpox, there is history of chickenpox in June of 2010. So maybe this was an updated record that we received, and we need to put this information into the table to be able to make this student compliant. So what I'm going to do is I'm just going to go ahead and edit the immunization grid so I can put this information in. So again, these are all pop-out boxes, so I can see this information side by side. I'm going to start with the Tdap of just entering that date of Tdap. So this is a 6-digit entrance here. So if I just type in 01/19 of 07 and hit enter here, Oops, wrong date. That was not the date that was the varicella date. So I entered the wrong date. I'm going to go ahead and delete that and start over here. So if I enter 131 of 17 here we go, and hit enter, that is now going to make this compliant. Now, when I entered the wrong date, you could see this automatically switched over after I entered the correct date to this white, meaning that it's compliant. When I had entered that incorrect varicella date, it was still showing as non-compliant, and that's for a reason. That Tdap, it cannot be given at that young of an age. So the system was still seeing, even though I accidentally made a mistake, it was showing me that that still was non-compliant, even though I entered the wrong date. So it's automatically going to catch those types of errors if it's given even before maybe a student's birthday, maybe you put in before they were born, whatever it may be, it's going to give you an invalid error to let you know that that's incorrect. So you can see that my Tdap is now compliant. However, my varicella is not compliant. So I'm going to come here directly to my varicella, and I'm going to click on my varicella because I want to add that I have a history of chickenpox here. So I'm going to go ahead and click on that varicella itself. And you can see we have exemption. We have an option for an exemption. So this would be maybe a religious exemption to the vaccine, a medical exemption to the vaccine. You can see you have those options. A titer, meaning that they've had a lab drawn to say that they have immunity to varicella. Or I'm going to come in and put in my history of illness. And so that's what we have history of here. So I'm going to go ahead and add my disease start date. I'm going to go ahead and choose June of 2010. I'm just going to add the 1st of June since we do not have an actual date here, and also add that as my ending date as well. You do need to have a beginning and end date of disease. I'm going to go ahead and say yes, that this has been documented, has been verified. I'm not going to add this file in here, but if you had a specific file, you could upload it here to add a different file, but this is already a part of the student's immunization record, so I'm not going to go ahead and do that. And once I hit save here, you're going to see that in the background here that my student has already, in just that short time of me hitting save, the system has calculated the compliance. So you're going to see that my student is now compliant. I do have an extra little check mark here that tells me there's something off about this varicella and that they have history of illness recorded. So with that, I can know that this student has this here, and that's why they're missing that second dose of varicella here. From here, you can also, we have the ability to export immunizations here. So it would export that information here for that student to have a record of if you needed to print off a record for their permanent file, whatever it may be. So that is a quick overview of our immunizations and entering them in. We're next going to move over to action plans. So because this student has diabetes, you're likely going to have a diabetic action plan on file for this student. Now, there are multiple ways that you can look at action plans or add action plans within our system. We have our own forms that you can add details to. So if I click into this diabetes management here, you can see that we have a fillable form here that you can enter specific information based off of maybe the documentation that you got from the doctor's office. So you could build your own one in here, or you could use whatever the doctor supplied to you at the school. So if I come over, I'm going to come over to my documents tab here and show that I have a actual diabetes plan on file from a doctor's office. Maybe this was a updated record here that I'm needing to update my care plan for. So I can pull that document up to be able to see it. If I can zoom in to be able to read it a little better if needed. But you can see in here that I have an action plan in here. Now, if I come back to my action plans, part of the chart here. This is an action plan that I had already generated, and I'm going to click this open as well. Got lots of things open here, but you can see, so this is that fill in information back here. This was a PDF created from all of this information that I was able to put in beforehand here. So if I got an updated plan here and I needed to come in and update this information, all I would need to do is come into this, and then I could generate a new PDF to match this order form that I have. So maybe this student didn't have a CGM before, and now a part of their pump, they do have a CGM. So I'm going to come down and look, and they now have continuous glucose monitoring at school. So I can go ahead and add that information in here that they now have a Dexcom. And then maybe that this is being monitored by the parents. And then we can use this CGM for insulin dosing unless it doesn't match. So both of those have been checked in this. From here, I can also choose how I'm viewing this. So you can add multiples here. You can add that it's a smartphone and an iPad. Maybe you have an iPad in the nurse's office and the student has a smartphone, and that's how you are monitoring the student's information. From here, I can also see that the alarms, I can go ahead and add that alarm information here. So my high alarm is 400 and my low alarm is 50. And then I can also add additional information here. So this was finger stick if less than 70 and above 300. And then if CGM is still below after 15 minutes, we can go ahead and add that number in. From here, notify the parent guardian. So this used to be 450. We can update that now to 55, and maybe they want to have a lower threshold here and add that in. So you can add in that information here to complete this plan. And once I'm done with that, I'm going to go ahead and exit out of this. I can see that I have all of this information already added. And then from here, I can go back to my files and generate a new file. You have the ability to hide empty fields if you don't want those shown, or you can keep them in the plan. So this takes a little bit of time. Once I am generating the new files, it does take a minute or two to add that new information in to give you a new PDF, but you can add that type of information in. Now, a part of our plans here, we do have more options here. You have a clean intermittent cath, you have an individual health plan, a G-tube plan. So these are all pre-built plans already within our system that you can use. But like I said too, you can always just drag and drop any files that you get from the doctor's office themselves to be able to have action plans that are specific, that just follow whatever the doctor's orders are. So maybe your asthma action plan, they have a strict red, yellow, green zone that you want to have as their action plan. You can just upload those files here directly. Let me see if those updates took place. Doesn't look like they had yet. Take a look here in a little bit. We can always come back to this to see those updates here within that generation. So from here, so for this student has diabetes, and one of the things on their plan was that they must have blood glucose monitoring at snack and before meals. So for a nurse, adding that in as a medication administration can be a little tricky because you're not always going to be administering medication. Sometimes when a student comes in for blood glucose monitoring, it's not always that you're going to be giving insulin depending on what their actual blood glucose is. So because of that, we want to add more of a procedure. We want to be able to look at this student and have the option to chart on either a medication or an encounter visit for them coming in. So for that, we're going to go ahead and head over to our procedures page here on the left-hand side. I'm going to keep my student card. I'm going to shrink it here for a second, and we're going to come back to it. If you close a student card, you can always open it back up, but I'm just going to shrink his student card for a second. So here in our procedures items, this is our staging environment. So if you were a school that was using procedures, you would actually have quite the list here, typically of procedures and maybe medication administrations that you have for students that maybe are, if you're needing to bill student information, maybe billing medication administration or the procedures that you do for these students, you can use our procedures to be able to capture that data of maybe it's a delegated procedure versus not being a delegated procedure, or how many medication administrations you have done for students. So here within our procedured items, we're going to come to the list here. I have one in here for a medication administration, but we're going to create another one here for Daniel since he's going to be needing PRN blood glucose checks as well as checks before meals and snacks. So I'm going to come in and create a procedure. And I'm going to name this procedure whatever it is that you want to name it. You can name all of your procedures the same categories maybe that you need, or you can put them to like a student name, whatever you want to do. So I'm going to go ahead and just put in daily blood sugar monitoring. And then I'm going to choose my student here as Ethan. And then if I had a service treatment, I could put that in. I'm just going to say blood sugar checks. And then this allows me to link the condition that this is the procedure for. So if my condition is here already because it's on the student card, I'm going to go ahead and choose my diabetes. Now, if the condition was not listed yet in the student chart for whatever reason, instead of having to go back to your student card, you can add it right here. Now you can put in your order start and end date. I always suggest putting in the start and end date so that you're not having to come in at the end of the year to end all of these procedures. So I can say that this is maybe this is a new order for this semester. I can add whether this is a PRN type of procedure that is also scheduled in PRN. If the student has an IEP part of this, you can add that as well. This is more to help you be able to collect data on this type of information for reporting purposes. If there's a diagnosis code, maybe this is a delegated procedure, you could go ahead and add that diagnosis code in for reporting. If there are any special instructions here, you can add that. For this schedule description, I'm going to add needs blood sugar checks before snack and lunch, also PRN with physical activity. If maybe this is an assigned delegated procedure, you could put in their teacher name here. I'm going to go ahead and link his medications to this. So I'm going to link the Humalog here that he has on file, as well as, oops, I forgot to press link. And then this schedule's here. So I had not created a schedule. You can see if I come in here, he does not have any schedules created. I'm going to go ahead and this is where I would create that schedule of that reoccurring blood glucose monitoring that I have. So I'm going to go ahead and create new here. And this is going to actually bring up another tab here. So I'm going to say daily blood sugar checks. And then I'm going to make this an encounter. From here, I can assign other people. Maybe this is where this is a delegated procedure. So I can assign another coworker that's going to also be needing to check this student's blood sugar, or maybe it's their delegated task. So I'm going to assign myself and that other person. From there, I'm also going to choose my encounter template. Now, for this specific encounter, we do have a reoccurring treatment called blood glucose monitoring. And once I'm done creating this schedule, we'll go ahead and look at what that template looks like. But you can see we also have tube feedings, trach care, intermittent cast, central line care, nebulizer treatments, and nutritional supplements. So those are all options that you can choose to be able to chart on those types of things. So I'm going to choose blood glucose monitoring. And then I'm going to add this as a reoccurring treatment. So I'm going to add that my student starting today needs to come in at 10:30 a.m. or 10 a.m., sorry, and 12:30 p.m. So I'm going to go ahead and choose my 10 a.m. My end date is going to be the end of the year here. And then I want this to happen on these 5 days of the week. Now, if I need to add another one, I can add my second one here. So I'm going to go ahead and add that in. And this one is going to be for that 12:30 time. From here, again, you just need to add your end date. I'm going to go ahead and add that end date here. And I can add my days of the week. Now, if your student comes in at different times, different days of the week, you can make that schedule. So you can uncheck certain days and change the schedule based off of your student's needs, especially if you have block scheduling or something like that, and the schedule is changing on a daily basis. You can make that accommodating here within the timings. So once I do that, I can hit create. And that is going to now add this blood sugar check for the student. From here, this is where I can say whether it's been delegated or not. I can say maybe when that training happened for that UAP, I can add that training date in here and then any comments I have on that. I can also list out the caregivers here that are the UAPs that have been checked off on this delegation. And then if you need extra authorization, so if you need to say that this was authorized by the parent here, you could put that information in and the date that it was given to you. And then you can also put in the prescriber information. So on my order, his name was Dr. Wilson, and I can put the order date in here as well, and that was prescribed in writing. You also have the ability to come in here and discontinue the order or update the order if that is something that you need to do. So once I've got all of my information that I need to put in here, none of these are required fields, so you can put in as little or as much as you want. I can go ahead and press create. Now in the background, that's going to now add this procedure back here that I have that I can always come in and look at and update if I need to. But you can see all of this information here about that student here within that new procedure that I've added. You can see extra details here that you need as well. From here, now that I've created that procedure, I can come back to my procedure items. And I can see on here that I have now these scheduled encounters for these blood sugar checks for this student. That will also appear on your board here. So you can see on my board that I also now have these upcoming scheduled items. So this helps your nurses keep track of what they have for the day, what's assigned to them. And I can also see that I have those encounters also here pre-populated on my chronological clock here of encounters for the day. So if I come back to procedures here, and maybe I wanted to chart on this 12:30 blood sugar check, I could come and click into it. And this is where I was going to show you this blood glucose monitoring template. So I can put in an N for now. Maybe it came in a little bit late, or I can adjust my time here. So this was at actually 12:32 and hit enter. That's going to then update my time here. There we go. And then I can put in what their monitoring was. So maybe blood sugar was 201. Don't need to do a finger stick. No ketones are needed. Maybe it's been 2 hours since his snack time. His carb intake is going to be 30 grams here. And I'm going to go ahead and add his medication here as a med administration. I'm going to go ahead and add his Humalog that we're going to be giving here. So if I come in here, I can see Ethan is the one who pulled up here, and I can select his Humalog. Now, this sliding scale and information was added on that medication card. It was added to the notes section here, so you can see all of your information about your Humalog. So if I'm looking at the blood glucose level for lunch, blood glucose monitoring was 200. So we're at it was 201 actually. So we're at 1 unit of insulin. And if they're having 30 grams of carbs for lunch, it's 1 unit per 15. So that's going to be 2 units of carbs to cover lunch, plus of that blood glucose monitoring, which is 1.5 units. So we're going to be giving 3.5 units to this student right now for to cover lunch. So I'm going to go ahead and add that we're doing that right now. Change this time here. And then I'm going to put in my 3.5 units. And then I always added extra notes here for my own sake to know what we gave for. So if I go ahead and add this administration, I've now not only documented here my blood sugar information, but also I've documented the medication as well. You can, if you want for reporting, you can add additional information here. Maybe you can put in the location that it was given. And once you're done with that, you can close your note, and that will be documented on, and that will take care of that scheduled item, and you'll see that that has now been documented on. That medication also flows over to your medication record here. So if I come in here, I can see that I also gave that Humalog here, and it comes over to my MAR. So last but not least, we're going to finish up with reporting. From here, I'm going to come over to my reporting page. So like I said, one of the big things a lot of schools focus on is the types of clinic visits that they're seeing, the types of students that they're seeing, how often students are coming in, as well as this time of year, like I said, flu is rampant, now COVID as well. So you kind of have to keep a pulse on that illness within your school. And you can do that via our clinic summary reports. So I'm under reporting here. I've already ran a report that we're going to use, but I'm going to show you here. Under the clinic summary, you can see that you can even go years back to maybe compare a year, maybe last January to this January, maybe see if your flu incidence has gone up, that kind of thing, or even see if your encounters have gone up. For me, I use this personally to be able to show how many students, the volume of students was going up. So here, if I were to choose 2024, I can see it by month here, or I can go for a whole school year. So we break it down into different types of categories, but then you can also change the variable of your dates as well, excuse me, once you're in a summary. So I'm going to go ahead and click on this one that I've already created just for the sake of time today. And you can see that I chose November of 2024, and this is our staging environment. So there's not a whole lot of data in here, but there's enough data to kind of show you this type of information. So this first look of information is just all of the students that, all the clinic encounters that you had for the month of November. So if I scroll down here, I can see kind of quick information about it, but I can see I saw a total 42 students or 42 encounters in the month of November. From here, I can also look at maybe administered medications, see how many meds I've administered. So if I come down, I can see I administered 51 different medications in the month of November. Encountered students is also a big one. This will give you a list of the students that came in and that were encountered. And then also your encounters with faculty. So if you're looking for maybe how many faculty came in, we can also look at that data here within the system. And then this one here is your students encountered in the clinic. So this is only going to count each student once, but it's going to tell you all of the students that have come into your clinic. So these are what we call queries, where it's giving you information, it's giving you detailed data. Then we have what we call our tally information. So this same students encountered in the clinic, you can see I have 24. I can then come to this tally of information. So if I didn't want to see the names of all the students, I can just quickly come in and see, okay, 24 out of my total 202 students were encountered during the month of November. And then I can also go in and see encounters by type. So this will break down the types of encounters that you had coming into your clinic in the nursing department. So it will break down by the encounter type that we use here. So you can see that we had 20 clinic visits, 10 headache visits, some playground injuries, some sore throat visits, and some stomach aches. So you can really see off the bat by just, you can come down to your numbers here, or you can hover over to see which ones are which here to get a quick look at that kind of information. Now, one of my favorite pieces of this is what we call chief complaints. So your chief complaints is why the student came in. This is where you would chart in your clinic visit the reason for the visit. And anytime you add a chief complaint, we calculate that data. So you can see in here that in the month of November, I had all of these different types of chief complaints. My biggest being headaches here. So I had 11 students with headaches. But if you were to have things like flu-like symptoms, things like that, you would be able to see that type of information here and see a tally of how many students came in with that type of chief complaint. And then last but not least, you can also see how many students you sent home, maybe how many students went back to class, those types of things. That is what we call the disposition. You can run that type of data. Again, you can do this for your whole school year or even a week time. You can change it to the week that you're looking at instead of a whole month. And you can see that information here to know how many students were sent home. So that is a quick, felt long, but a quick kind of overview of the system. I don't know if there have been any questions in the chat or anything that anything that wanted to be more detailed, but I'll hand it back over to you, Victoria.
Yeah, awesome. It's something I wanted to add. The reports are so cool. And one of the things from the case study we did with Lancaster City School District, Sarah is the district health coordinator. She talked a lot about how the reports made it so easy for her to go to her administration, her school leadership, her superintendent, and showcase how many students were coming into the clinic, because the board, the superintendent, they had no idea like the workload that the nursing team had. And so finally she was like, it was so validating to finally have the numbers to be able to go and say, we need to hire another person on this team. Like, look how many students are coming into the clinic. And so she was actually able to hire 2 additional team members just because they finally had the data to prove how dire it was and how much they needed more more staff. So I'll share I'll share the case studies here in case y'all want to check them out. But feel free to put any questions in the chat. This recording will be sent out after. So if you have any colleagues who want to check it out, or if people had to drop off because a student came into the clinic, all good. So this will be sent out after. But yeah, let us know if you have any questions. Always feel free to reach out. But huge thank you to Laura for doing such a thorough deep dive into the platform. It's always so awesome to see all the cool little things. So wonderful.